Hello, thanks for coming to the Module 9 synopsis. We're going to talk about personality, dissociative, somatoform, and factitious disorders. Here are your Module 9 objectives. As always, take a look through them, make sure you've met them all. If you feel like you haven't, go back through the lessons and see if you can find anything that can help you put the pieces together. What did you learn with one of these objectives that you are certain you'll apply in practice? All right, let's get into it. Basic concepts of personality disorders. A person's personality is a relatively stable pattern of thinking, feeling, and behaving that evolves over the lifetime. Personality traits are characteristics, whether considered positive or negative, that make up your personality. Healthy personality traits are demonstrating healthy personal boundaries, accepting responsibility, communicating in a healthy and effective manner, obeying laws, showing mutual respect in relationships, being independent, displaying confidence, and behaving in a non-impulsive manner. When people have personality disorders, it's an enduring pattern of inner experiences and behavior that deviates significantly from the expectations of one's culture. Its onset can be traced back to adolescence or early adulthood, and it's present in a variety of contexts. So the behavior is manifested in two or more of the following areas: cognition, ways of perceiving and interpreting self, other people, and events; affect, which is the range, intensity, ability, and appropriateness of emotional response; interpersonal functioning; and impulse control. Personality disorders are clustered into three: Cluster A, Cluster B, and Cluster C. Cluster A personality disorders include paranoid personality disorder, schizoid personality disorder, and schizotypal personality disorder. Cluster A is characterized as the odd, eccentric cluster. Diagnosed individuals have four or more of the following characteristics. They suspect without evidence that others are exploiting, harming, or deceiving them, preoccupied with unjustified doubts about the loyalty or trustworthiness of friends and associates, reluctant to confide in others because they fear the information will be used against them. They read into meanings of benign remarks and think that there is something hidden there. They persistently bear grudges. They perceive attacks on their character or reputation, and they have recurrent suspicions without justification regarding fidelity of a spouse or sexual partner. Cluster B personality disorders include antisocial, borderline, histrionic, and narcissistic personality disorders. Cluster B disorders are characterized by dramatic, overly emotional, or unpredictable thinking or behavior. Cluster C personality disorders include avoidant, dependent, and obsessive-compulsive personality disorders. Cluster C personality disorders are characterized by anxious, fearful thinking or behavior. Risk factors for personality disorders come from genetics, childhood trauma, peer influences, and other factors that contribute in the development of a person's personality, can lead to personality disorders. Treatment for personality disorders include psychotherapy and pharmacotherapy. For psychotherapy, particularly helpful is cognitive behavioral therapy, dialectical behavioral therapy, interpersonal therapy, psychoanalytic and psychodynamic therapy, and psychoeducation. For pharmacotherapy, there are medications that can be used off-label. That means they're not necessarily approved by the U.S. Food and Drug Administration for individuals with personality disorders. The goal is to treat the symptoms that cause impairment, and medications are used to treat these. Cognitive perceptual symptoms like hallucinations, paranoid ideations, impulsive behaviors like self-injury, theft, interpersonal conflict, and affective dysregulation like depressed mood, mood lability, anxiety, and anger. Make sure you have watched the separate presentation where we take a deeper dive into personality disorders. Which specific personality disorder was the most interesting to learn about? Now let's apply the nursing process to personality disorders in a quick chat. Assessment. Findings for clients hospitalized with borderline personality disorder may include feelings of emptiness, self-mutilation, suicidal behaviors, gestures and threats, extreme mood shifts that occur in a matter of hours or days, impulsive behavior, intense feelings of abandonment, a tendency towards anger, sarcasm, and bitterness, and intense, unstable relationships. Make sure you take a look at those diagnostics and lab work. Nursing diagnoses. 4. Cluster A, social isolation, disturbed thought process, risk for loneliness. Cluster B, risk for suicide, risk for self-directed violence, social isolation, chronic low self-esteem, ineffective coping. Cluster C, risk for loneliness, anxiety, social isolation. Make sure you take a look at Table 10.4 in Subchapter 10.4 for some additional information there. Outcomes identification. In the acute care setting, the focus for goals and outcomes is the reason for the admission, which can include conditions like suicidal ideation, self-injury, severe depression, or severe anxiety. Some SMART goals. Outcomes. For clients hospitalized with borderline personality disorder, remain safe and free of injury. They'll seek help from staff when experiencing urges to self-mutilate. The client will identify triggers for self-mutilation, describe 2 preferred healthy coping strategies. Planning interventions. Individuals diagnosed with borderline personality disorder may be suicidal, self-mutilating, impulsive, angry, manipulative, or aggressive. Nurse plan interventions accord to the symptoms that the client is currently exhibiting. Clear boundaries and limits need to be set and consistently reinforced by the healthcare team. Implementation. Promote safety for all personality disorders. I know this is using borderline personality disorder as an example. Keep that in mind. Safety. Identify thoughts and behaviors that increase the risk of harming themselves or others. Identify triggering people, events, and situations. Implement coping strategies. Reach out to other coping resources. De-escalating. Speak in a calm voice. Avoid overreacting. Implement active listening. Express support and concern. Avoid continuous eye contact. Ask how you can help. Reduce stimuli. Move slowly. Remain patient. Don't rush. Offer options instead of taking control. Avoid touching. Verbalize actions before initiating them. Provide space. Avoid arguing and judgmental comments. Coping strategies. Teaching self-care and coping strategies is helpful for people with personality disorders. For clients seeking immediate relief from intense symptoms such as panic or depersonalization, nurses can teach them how to stimulate the parasympathetic nervous system. Apply ice or cold water to the face. Perform paced breathing techniques when the exhalation phase is at least 2 to 4 counts longer than the inhalation phase. Collaborative interventions, very important. Psychotherapy, pharmacotherapy, work together, and different types of psychotherapy and different types of pharmacotherapy. Evaluation, refer to the SMART goals and outcomes established for each individual client to evaluate the effectiveness of the planned intervention. Modification of the established nursing care plan may be required based on the effectiveness of the interventions. Symptom and related disorders. So SSDs and related disorders involve a person having a significant focus on physical concerns or complaints that result in disruption in daily life. Somatization is when emotional distress and psychological issues are exhibited in physical manifestations and cannot be explained medically. Physical symptoms like pain, anxiety, fear, preoccupation, fast heartbeat, all of those things can be somatization. Manifestations also include gastrointestinal issues and sexual difficulties. The severity of symptoms may be exacerbated because the client begins to feel hopeless and helpless as their symptoms cannot be scientifically explained. Diagnostic criteria for SSDs include 1 or more somatic symptoms that are distressing and result in significant disruption of daily life. Excessive thoughts, feelings, or behaviors related to the somatic symptoms, disproportionate and persistent thoughts about the seriousness of one's symptoms, persistently high level of anxiety about health or symptoms, excessive time and energy devoted to these symptoms, and although any one somatic symptom may not be continuously present, the state of being symptomatic is persistent. Mixing some epidemiology in there. The somatic symptom disorders can be diagnosed at any age, but these disorders are increasing in the number of occurrence, especially in childhood and adolescence, with a higher prevalence in female population. The prevalence of somatic system disorders in older adults is higher than in the younger population, and SSD severity tends to worsen with age. SSD may be underdiagnosed in the elderly because some of the symptoms like pain and fatigue are considered normal parts of aging. That is stereotyping and generalizations, so we need to avoid that. It's estimated the prevalence of SSD is 4 to 6% of the general population. More females live with this disorder than males at a ratio of 10 to 1, and it can occur in childhood, adolescence, or adulthood. A number of factors have been associated with the etiology of SSD, including biological, genetic vulnerabilities such as being more sensitive to pain, early traumatic experiences, and learned behaviors such as reinforcement of the sick role. What is one way this module has changed your perspective on somatic system disorders? Somatic system disorders in the nursing process in a quick chat. Assessment. Assessment of a client who has somatic symptom disorder can be complicated. The nurse has to carefully assess the onset, location, and duration of client manifestations. Manifestations that are reported will vary greatly. The nurse must also assess the client's use of medications. Some clients may become reliant on medication in an attempt to relieve pain or anxiety. Additionally, the nurse must assess the client's coping skills and the client's ability to communicate. Also, do a complete assessment and make sure that the client's complaints have been previously evaluated. If there are new symptoms, make sure they receive a complete evaluation of those. Considerations for somatic symptom disorder in the nursing process. Sometimes clients with these disorders have trouble communicating their emotional needs. They're able to describe their physical manifestations, but they have a challenging time discussing their emotional needs. It is essential that any neurological conditions be ruled out. It's important for the nurse to assess acute stressors and previous history of trauma. The nurse should plan safety interventions around the client's manifestations. Nursing interventions. So, effective therapeutic communication is essential at all levels of care. The client should be assisted in developing positive coping skills to help manage the bodily distress. It's also important to discuss relaxation techniques, teach and encourage them. Encourage them to participate in cognitive behavioral therapy. Mindfulness-based interventions are also very important here. Encourage positive thinking, assist the client in setting realistic goals, provide symptomatic relief measures such as pain medication or digestive relief. Always include a careful assessment and determine what has worked for the client. Encourage self-management. Promote education about the disorder and the association between symptom pathways for physical pain and emotional symptoms and their similarities. This can help the client understand the relationship between their physical and emotional symptoms. Provide medication education and encourage adherence. Focus on communication and facilitation of emotions over symptom severity. Implementation. Clients who have somatic symptoms and related disorders are rarely admitted to the inpatient mental health setting with this diagnosis alone. There's usually additional criteria: severe depression or suicidal thoughts. The therapeutic relationship is very important to help the client's resistance to the idea that no physical cause is present for their manifestations, as well as address the client's likelihood to go from caregiver to caregiver. The nurse should prepare to help the client meet their needs without having to resort to somatization. Evaluation. Commonly, the nurse will find that goals and outcomes for treatment are only partially met, as clients are likely to experience somatic symptoms on a long-term basis. Make sure that you look at the interventions that have been put in place so you can evaluate the patient's progress towards those goals and outcomes. Dissociative disorders. These are characterized by a disruption in the way that memory, consciousness, identity, emotion, motor control, and behavior interact with each other. Dissociation can be present in a person who experienced a history of trauma. When they experience dissociation, they may re-experience previous trauma, switch to an altered personality, or have flashbacks and nightmares. Dissociative amnesia disorder. It's defined by the inability to remember certain experiences which are usually stressful. The inability to remember may be related to specific memories or include much of the client's history, even their own identity. Dissociative amnesia can be localized when they're unable to remember an event or period of time, selective, unable to remember a specific aspect of an event or some events within a period of time, or generalized, which is a complete loss of identity. That's rare. Dissociative amnesia is associated with adverse childhood experiences, emotional abuse, neglect. People may be unaware of their memory loss. Depersonalization and derealization disorder is when the client experiences a detachment from their surroundings. They may describe the feeling like they're floating out of their body or that they are in a dreamlike state. Dissociative identity disorder, otherwise known in pop culture as multiple personality disorder, is two or more distinct identities that take control of client behavior. It involves sudden and temporary changes in consciousness, behavior, and identity. Dissociative identity disorder becomes a diagnosis when client experiences a disruptive identity characterized by two or more distinct personality states. A client who has DID experiences at least two separate identities known as alters that function independently of one another. Those identities have their own separate behaviors, memories, and may even speak different languages or exhibit different facial expressions. Biological and etiological risk factors. For dissociative disorders, these are influenced by the environment, genetic, and physiological factors. There have been twin studies done on dissociative disorders, and they were often explained entirely on the basis of exposure to trauma or learned behavior. Depersonalization derealization disorder has a tendency for comorbidities. These manifestations of anxiety and depression are common for individuals diagnosed with depersonalization and derealization. Clinically diagnosed dissociative identity disorder is rare. It's thought to be caused by incredibly traumatic experiences. Let's talk about dissociative disorders in the nursing process in a quick chat. Assessment. It's important for the nurse to assess specific information related to life events such as abuse, trauma, as well as depression and anxiety. The nurse must also assess suicide risk and the impact that the dissociative identity disorder has on the client's life. Memory assessment is important. Be familiar with the client's baseline and prioritize managing the client's stress and anxiety. Create and maintain a safe and controlled environment. Planning. The setting in which the nurse is providing care greatly influences the planning. Safety is the top priority. Nursing interventions. One of those most important skills of the professional nurse is the ability to communicate and display empathetic listening. It's important and a valuable skill and should be applied in all areas of mental health nursing, but it's particularly important when clients are examining their previous difficulties, such as trauma. Take action. Implementation. During periods of dissociation or when the client is recalling traumatic experiences from the past, the nurse should present and provide one-on-one therapeutic interaction and support. During times of dissociation, the nurse should provide a simple routine and assist with decision-making, confirm the identity of the client as well as the client orientation, provide one-on-one therapeutic interaction, reflect on the client's feelings, use affirmations, teach stress reduction, and provide a safe environment. The nurse must also engage in psychoeducation and educate the client about the disorder. The nurse should be prepared to explain that the client's manifestations are in response to stressful events. What is one thing you've learned about dissociative disorders? All right, we are on the home stretch. We're going to talk about a few more disorders. Let's start with factitious disorder. This is diagnosed when a client knowingly produces manifestations to assume the sick role. There are two types of factitious disorders, the type that is imposed on the individual and the type that is imposed on another. The biggest example of this is Munchausen's. Munchausen's is imposed on the individual, and Munchausen's by proxy is imposed on another person. So factitious disorders when the client falsifies their symptoms to themselves or others, even when there is no external reward for doing so. This is not the same thing as malingering. Malingering is not a factitious disorder. That is the intentional reporting of symptoms for personal gain. Treatment of the factitious disorder. The goal of the treatment is to limit the risk of adverse events and self-harm of the patient to reduce the number of treatments and procedures. Psychotherapy is the first-line treatment. Psychotherapy is the treatment of choice, and it often involves a multidisciplinary team. Medications like SSRIs may be used to treat symptoms and or any co-occurring mental health disorders, but not usually to treat the factitious disorder itself. Challenges in caring for the client with factitious disorder. They'll often go from one provider or hospital to another. They have reluctance in allowing healthcare professionals to speak to family, friends, or previous healthcare providers who cared for the client. If they have this disorder, they could cause significant harm to themselves or others, and they can be labile or angry if the hospital does not follow through with their requests. Considerations for the nursing process. It's the primary responsibility of the nurse to provide the client with a careful assessment and document the care provided. Safety is the priority. and the nurse must carefully monitor the client who intentionally harms themselves. They will also work closely with the entire health team, should work towards maintaining safety as the priority, and carefully evaluate interventions. So next is illness anxiety disorder. This is characterized by a client experiencing anxiety or having fear about developing a serious illness. Illness anxiety disorder was previously known as hypochondriasis, is when a client experiences constant thoughts about having significant illness. Often, the client is misinterpreting their symptoms and may seek extensive treatment as a form of relieving their anxiety. Manifestations related to illness anxiety disorder are constantly research specific manifestations or disease, continually exaggerating manifestations, obsessing about body functions and vital signs, high levels of anxiety related to health status, and oversharing manifestations with others or constantly seeking reassurance. Treatment of illness anxiety disorder. The goal of the treatment is to reduce the anxiety and improve the quality of life of the client. Treatments with antidepressants, particularly SSRIs such as fluoxetine, have shown to improve manifestations in clients who have this disorder. Therapy, including psychotherapy and cognitive behavioral therapy, has been determined to be effective. Considerations for illness anxiety disorders in the nursing process. The nurse should always assess the client's anxiety and depression level along with manifestations of illness anxiety disorder. The nurse should always assess the client for suicidal thoughts and safety concerns. Clients who have this disorder are rarely admitted to the inpatient setting unless there is a safety concern. The nurse often works with clients on an outpatient basis, and they should be prepared to provide health teaching to the client. So, next is functional neurological symptom disorder. This is a condition in which neurological manifestations are present without an identifiable medical cause. This is also called conversion disorder, and it involves altered voluntary motor or sensory function, symptoms without an identified medical cause. It's considered a psychiatric disorder where emotional stress presents in physical symptoms. Neurological symptoms may include blindness, paralysis, inability to swallow, or impairments walking. Comorbidities such as depression, anxiety, and post-traumatic stress disorder are often present. A history of childhood abuse is also often present. Treatment of functional neurological symptom disorder. There are no specific treatments for this, but there are treatments for some of the symptoms. An interdisciplinary team works together to provide comprehensive care. Some of the ways to manage symptoms include psychotherapy and cognitive behavioral therapy. Physical, speech, and occupational therapy can also be helpful. Transcranial magnetic stimulation is useful for the treatment of depression, anxiety, and the pain associated with FNSD. Additionally, medications can be prescribed to treat pain, anxiety, depression, insomnia, or headache that may occur. Antidepressants and anti-anxiety medications are often used to treat co-occurring anxiety and depression. The nurse should work with the client to develop positive coping skills and reduce stress and anxiety. What was the most surprising aspect of treatments for these other disorders? You made it! Thanks for sticking with me. Keep working hard.